A cancer diagnosis is an incredibly personal and often frightening journey. But what if that journey was completely different just because of where you live? Today, we're diving into cancer care on the island of Ireland, where you have two totally separate healthcare systems running right alongside each other. So just picture it. You notice a symptom, something you just can't shake. You make that nerve-wracking call to your doctor. What happens in those first few hours, those crucial days and weeks? Well, the answer is anything but simple. Because on this one island, the path you're about to go down is literally decided by your postcode. It's what determines which system you enter, what the rules are, and really, what your entire experience is going to be like. So let's meet the two main players. In the Republic of Ireland, you've got the Health Service Executive, or the HSE, and in Northern Ireland, it's the National Health Service, the NHS. Two very different models, both tackling the exact same fight. So, what are the big picture differences? Well, in Ireland, you've got the public HSE system, but private health insurance is a big deal, often acting as a sort of fast lane for access. Up in Northern Ireland, it's that classic NHS model, free for everyone when you need it. Both have their own national bodies trying to steer the ship. Okay, so let's start at the very beginning. That first critical moment when a patient, or maybe a screening test, sounds the alarm. And right away, we see a massive difference. In Ireland, getting a patient referred to a specialist can really depend on the GP's own experience and know-how because there isn't one single clear pathway for every type of suspected cancer. In Northern Ireland, the process is way more structured, but the system is so strained that it creates a whole different set of roadblocks. And this brings us to what is, for so many people, the absolute worst part of the journey, the waiting game. That time you spend in limbo between being referred and actually getting a clear diagnosis. In Ireland, getting from A to B, getting scans, a biopsy, and then having a whole team of specialists review your case can take weeks, sometimes months. And here's that phrase you never want to hear, the postcode lottery. It's a real thing. Your wait time could be way longer simply because of where you happen to live. Now, in Northern Ireland, the process looks a little different on paper, but the problem feels painfully familiar. An urgent referral gets logged, but because of these huge systemic backlogs, delays in getting scans and results are just common. The wait for answers can feel like an eternity. I just want you to look at this number for a second, 32.5%. Let it sink in. What do you think that means? Well, here it is. In Northern Ireland, there's an official target. A patient with a suspected cancer should start their treatment within 62 days of an urgent referral from their GP. The reality? Only 32.5% of people actually meet that target. And this chart, wow, this shows you the true scale of the problem. The goal, the official target, is that 95% of patients should be in treatment within that 2-month window. The actual performance is nowhere close. It's a massive gap, and it represents thousands of people waiting anxiously.
So once a diagnosis is finally confirmed, the real fight can begin. Let's take a look at how patients actually get access to treatment in each system.
So in Ireland, care is mostly focused in 8 designated cancer centers. You've got major hospitals in Dublin, Cork, and Galway handling things like surgery and chemo, and then a national center in Dublin that specializes in radiotherapy. But here is a huge challenge in the Irish system. This quote from the Irish Cancer Society really says it all. For public patients, getting access to new cutting-edge cancer drugs can be delayed by around 2 years. 2 years! That's a lifetime when you're fighting cancer. Over in Northern Ireland, the system is much more centralized. There's one main cancer center in Belfast that handles most of the complex cases, and then smaller units in other hospitals that provide more local services. The big problem here, though, it's staffing. There are critical shortages of specialists. We're talking radiologists who read the scans and oncologists who manage treatment. And that creates these terrible bottlenecks that slow down everything from getting diagnosed in the first place to actually starting your care. And of course, the journey is not over when the treatment stops. The road back to recovery is long, and the support that people need is just immense. And on this front, it doesn't matter what system you're in. The needs are universal. Follow-up appointments, physical therapy, help with nutrition, and, so importantly, psychological support. All of it is absolutely vital for rebuilding your life. But the way that support is delivered is pretty different. In Ireland, charities like the Irish Cancer Society play this enormous independent role, offering everything from driving patients to appointments to providing counseling. In Northern Ireland, it's a bit more integrated into this system, with the NHS formally partnering with amazing groups like Macmillan, who you'll often find working right inside the hospitals. So, we've walked through these two very different journeys. What does it all tell us? Well, we've seen two completely different paths, but both are aiming for the exact same goal: to save lives. And when you put it all side by side like this, the trade-offs become incredibly clear. Ireland struggles with that diagnostic postcode lottery and really slow access to new drugs for public patients. Northern Ireland is more consistent, but it consistently fails to meet its own waiting time targets, even though it's faster with new drugs. And what's the one thing they have in common? Both systems lean heavily on charities to fill the gaps. And that really leaves us with the final big question. You have two systems on one small island, and each one has its own unique strengths and its own very real struggles. The point here isn't to ask which one is better. The real question is, what can they learn from each other? How can they share what works to fix the delays, speed up innovation, and ultimately build a better, smoother path for every single patient, no matter which side of the border they call home?